Thanks for staying with us here on The Pulse. Now, the 2022 Ghana Demographic and Health Survey report has revealed that the number of women that are overweight are more than twice as men. The report specifies that 50.2% of women aged 15 to 49 are either overweight or obese, with 20.7% of men within that age bracket also either overweight or obese. Government statistician Samuel Enim added that people in urban centers tend to be weightier than those in rural communities.
The issue of obesity, but both from the children perspective and the adult perspective. The conversation on obesity would always have to be looked at from the perspective of the drivers of obesity. Prior to the statistics on obesity, we showed our consumption patterns in terms of women that are consuming diversified food and women that are consuming unhealthy food. And what we put out there is that we have about 50% of our women aged 15 to 49 years that are consuming unhealthy food, specifically French fries, the chocolates, all the food that comes with heavy oil base are identified as unhealthy food. And this has translated in we seeing that about 50% of our women are either obese or overweight, specifically about 22% of them that are obese and 28% of them that are overweight. While we see lower numbers for males, but it's still a matter of concern. About a fifth of our men 15 to 49 years are either obese or overweight, specifically with 3.9% of them being obese. We see a relationship between children that are obese and their age. We see a higher percentage of those 0 to 6 months that are obese, specifically about 8.2%, and this figure reduces to about 2% for children within the age bracket 40 to 59 months. What we've realized is that of the 17 Sustainable Development Goals, the Demographic and Health Survey is able to give us information on 7 out of the 17 Sustainable Development Goals. For instance, the Sustainable Development Goal 1, which touches on no poverty, through the data collection around issues of health, wealth, and basic services, we are able to provide an updated data on no poverty. The same applies to zero hunger, good health, quality education, gender equality, and also partnerships based on the proportion of people that are using internet services.
Well, joining us in studio now is Godwin Odejabi, head of Demographic Statistics, Directorate of the Ghana Statistical Service. And thanks for your time here in studio with us. Of course, I'm just trying to go through a number of very interesting findings that we see in this very document. Quite a simple one that you've summarized for us, pointing out a number of issues relating to demographics and health, which is very critical for any nation that wants to develop. But let's start off with this concern about women's nutritional status across the country. The fact that, quote, 50% are overweight or obese, as the report is finding out. What's the implication?
Well, thank you very much, and greetings from Ghana Statistical Service. Today we launched the 2022 Ghana Demographic and Health Survey. The main idea behind this is to look at our population and health situation. So we look at a number of issues relating to fertility, child mortality, nutritional status of women and children, and then also our lifestyle. So one is the issue relating to our weight and height and all those things. So we did that for children and then women. So and then it's also got to do with our dietary issues. So if you listen this morning carefully to the government statistician, he made mention the proportion of women who possibly take what is called dietary practices, and we have the minimum dietary diversity, which the preferred one, and that one is the 50%, where, and then also those who have been taking sweet beverages, and then also they form the 37%. And we have the other group, those who have been taking the unhealthy food, they constitute 28%, and all this in have implication on our life. So it's one of the key issues which we pointed out today in the lunch.
I see, and I'm concerned about women, as I was pointing out earlier, about
so
their dietary condition.
It has health implications.
Yes.
It has health implications. As we overweight, it has implication on our health. That's we are inviting diseases to our body because we've not been exercises and all those things. So it's a concern, it's a policy issue which we need to address, looking at the figures.
I'm looking at the age distribution, and it's somewhere around 20 to 49.
Yes.
That's quite a youthful population there.
Actually, yeah, the demographic and health survey for women, we pick information from 15 to 49 years. Right. So that cutoff, 20 to 49, as a key issue. And these are the time women will be in their reproductive age group. So once they become obese, and issues relating to pregnancy will definitely affect the other. So we're using the DHS to monitor our health programs.
And to be fair, also, there's also the provision for men. It's not as though this is all about women. And also, you've been looking at some critical aspects to children's nutrition and how the issue of stunted growth has become a national challenge. I'm looking at the national distribution here with significant figures, for instance, coming through from the northeast region, 29%, as high as 29%. And of course, you have the Greater Accra region. The figure is not too clear there, but they are equally experiencing some very worrying percentage points. Why are we seeing the increasing case of stunted growth across the country?
Yes, it's got to do with the nutritional status of those children. And looking at one's age and height, supposed to achieve a particular nutritional status. So putting all these things into consideration and being measured in a standard way, you'll be able to measure those who are standard by looking at the person's height to age and all those things. Yeah. And then, and it's all boiled down to the nutritional status of these children. So it's cut across. Though we've done well over the years, but then there are still variations in terms of the nutritional status of children, as you've mentioned, and what we had in the morning.
The infant mortality rate also coming down significantly, as we're seeing on this chart you've provided, giving us a trend of what's happening across the country. It appears we're doing well, looking at the figures from the 80s, as you've tracked it, all the way to 2022. Have you gone back to check perhaps what's accounting for this? If this is more driven by medical infrastructure, or perhaps it's just a case of advanced technology, if we should put it that way.
Yes, we've done well, because if you look at where we're coming from for the infant, as far as 77 deaths per 1,000 live births, that is 1988. Now it has come down to 28 for the 2022 Demographic and Health Survey. Let's see that we've really come far. And it's got to do with practices and then behavioral issues. Issues like children attending to healthcare facilities when they are sick, and mother attending to the children, and all those things. Also, will reduce the infant mortality if we're able to take all these things into consideration. So I can say that basically our practices, healthcare issues, seeking healthcare at the appropriate time, will all reduce the what is called the infant mortality, as well as the nutritional status of all these children. If they are not malnourished and all those things, will definitely help us to reduce the infant mortality. That is the reason why you've seen the figures.
Yeah, and again, you're painting a national picture, giving a regional breakdown as well. And here again, somewhere up north in the Upper East region, you have the figures surging really high. Is it the case that there's some peculiar challenge with the northern parts of the country in terms of stunted growth? You have, child mortality also facing quite a significant challenge there.
Yes, so as I mentioned, though we didn't ask why there's this high death in the district, but then you can adduce from issues relating to health issues and practices. Compared to the southern part where we've been having access to health issues. So if you look at what was presented this morning,
yes,
we look at the distance to the health facility.
Okay, so that could be another contributor.
Distance to health facilities. We look at those who do more than 2 hours or more. So from as low as 0.8% in Eastern region,
right.
Yes, we have as high as 11.6% in around OT side. So
once you start going up north, there's a challenge of access or perhaps proximity to.
Not really because we've not done scientific that when you go up,
exactly.
yes. But then
the trends are showing that the numbers are higher up there.
Yes, the numbers in the northern part of Ghana, the numbers are high, and it is not what is called a recent issue. It's if you look at the time we conducted the DHS survey, from 1988. Yes, but it has been coming down, but we can still say that it is still high.
If there's anything the nation needs to be picking up from these findings you're putting out, what recommendations are you putting out there, and why would you say that these figures that you're putting out in this latest report ought to be taken seriously?
Yeah, so we if you look at our findings, we attempt to compare it to our national target and the global SDG goals to see whether by 2030 we'll be able to achieve some of these SDG indicators. So issues relating to access to health facility, the more closer it is, the more people can, or the population can have access to this health listing. And then also the times we visit the what is called the hospitals, the clinics, also is an issue. Once there's a sickness, and then you are able to visit there at that same day, that would be better because you have access to healthcare compared to those who delay in going to the distance. So putting all these things together will account for our health status, whether we're doing well or not.
Are we going to make that target based on the projections you're making now and all these figures that you're putting?
Yes, together? Ghana, we've done very well, and if you look at the infant mortality rate. Right. Now we're hovering around 28, but the expectation is that yes, it should be maybe less than 12. Then the under 5 will be less than 25. So if you look at where we are now, yes. Under 5 we are at somewhere 40 deaths per 1,000 live births.
Yes.
As to whether by the 2030 we'll be able to achieve this, is what we need to fight for. We need to work towards it and see whether by 2030 we should be able to achieve the under 5 and then the infant mortality target.
Would you say that we need some more time beyond the 2030 target to at least deal with some of the
target is the 2030.
Yeah, that's the deadline.
Yes.
Or that's
so
the time
what we have to do is to work towards the 2030 through health intervention programs and all those things. Then we'll be able to reduce the infant to a bearable minimum to hit that target.
Yeah, but if it took us more than 10 years to get to where we are now.
Yes.
Going by the rate at the decrease.
Yes, so we may be able to achieve some of the targets.
Decreasing rate. You obviously know that will be a challenge.
We may be able to achieve some of the targets. Some too we may not be able to achieve.
And which one do you predict might be?
No, I will not predict now. I will not.
Yes, because I'm just looking at the numbers and trying to make sense of them.
Yes, I think
1988, for instance, as you're putting
the beauty of it is
to 2022, it's moving from 77, bringing us to 28 per 1,000 live births, right? So we still need the same period of time, or at least half of it, to clear everything out.
Yes. So if you look at where we were in 2014 for the under 5 mortality. It was 60 deaths per 1,000 live births. And then by 2022, yes, we moved to 40. So it's possible we can achieve, looking at the way we're going down to that level. Right. Yes, it's possible we can achieve some too. We may not be able to achieve.
And I was talking about the recommendations earlier, and if there are some recommendations you've put into this document, at least to inform policy and to inform action from stakeholders, what would that be?
Yes, definitely. We've been working with Ghana's health service in monitoring of these programs. So if you look at the issues we raise, one is got to do with the seeking of services. So the campaign should go on. And then also proximity to these essential facilities, we should look at it and see how best we can minimize the distance people travel in seeking health services. All these things are some of the issues you can pick on and then make recommendation so that once we work towards it, we'll be able to reduce our infant and under 5.
And to be fair as well, your findings end at 2022, which means that we have, a 2-year lag, if we can put it out as such. If we're to carry out a survey today, looking at some of the findings you've made, do you have a sense of belief that things might either have improved or decreased?
Yeah, so once we've launched this report, Ghana Health Service have been using the report to study the report and then improve on the services that they've been delivering. So that is the reason why you see most of the indicators are going down because of the data they've been planning with and then working towards that they will be able to reduce those what is called areas where we think are high to a bearable figure for us to sometimes achieve the SDG targets.
The World Bank, the Global Fund as well, are all partners in this project. The issue about funding, that will be critical if we want to speedily beat the curve, as some experts will say. How crucial is the issue of funding, both to...
No, for funding, I think I may not go there because I will leave that one for the Ghana Health Service. But for funding for data collection and all those things, and then coming out with reports and all those things, I think we are doing very well.
Well, we'll have to leave it here. Thank you so much for spending some time with us here on The Pulse. And that's it about the 2022 Demographic and Health Survey, a report there for you by the Ghana Statistical Service. But we stay on the environment because the Environmental Protection Agency, EPA, is charging the private sector to explore positive aspects of the climate change effect. The CEO of the EPA, Dr. Henry Kofi, speaking at a carbon credit agreement signing between the Jospon Group and EKI Energies, said the climate change is negatively affecting human activity. It also has a positive aspect. He therefore strongly urged Ghanaian businesses to explore the positive side of climate change to make climate-smart investments.
Change is impacting the people in several ways as the country sits at the intersection of 3 hydroclimatic zones. Changes in rainfall, weather conditions, and sea level rise will affect the salinity of coastal waters. This is expected to negatively affect both farming and fishing activities. However, the Chief Executive Officer of the Environmental Protection Agency, Dr. Henry Kofi, speaking at a carbon credit agreement between the Jospon Group and EKI Energies, said Ghanaian private sector businesses must explore the positives of climate change.
There are lots of advantages out there, particularly for the private sector. And Jospon Group of companies, Dr. Ejapon has done so well, leading the way and the pathway. We've been talking about climate change effects, the negative aspect, but there are positive factors, and that is what you are witnessing. There are climate-smart investment out there. 175 different areas that one can invest in, running from nature-based solutions to built environment solutions, whereby recycling, reuse, and the circular economy closing the circuit. So it is a very good example. It is for all of us to see that going forward, climate prosperity plans also involves the private sector, non-state actors to come on board to play.
The $1 billion carbon credit agreement between the two companies is to boost Ghana's carbon credit rating over 5 years and also to give the Jospon Group an exclusive carbon trading right with EKI Energy Services. Joseph Siawe Japan is the CEO of the Jospon Group.
Briefly, it's partnership and collaboration. We all know that the world now is into carbon, it's into climate change issues, and as Jospon, that we are yet coming in. We needed a partner strong like EKI to handhold us so that we can develop very strongly into that market. So it's a collaboration in terms of technical, finance, and development so that we can get into that space of business very, very strongly. So this year, 2024, we're going to map up strategies of how developing better into this market by taking each segment very strongly and then seeking the technical advice of Ministry of Environment in the person of Dr. Derry and Dr. Benefo and all the other carbon credit officers. And then also with EKI coming in, I think that we're going to go a long way for carbon issues to help this country, Ghana, and as well as everyone.
The CEO of EKI Energy Services, Manish Kumar Dabkara, assured of the company's commitment and readiness to execute the agreement.
So, since we do have supplied more than 200 million credits till date, and we do have very good expertise to work on various different programs which are there in the international carbon markets, various different technologies which are located in various different nations. So, we do have very good technical expertise to execute the project right from the project installation or doing EPC, getting the project registrations, getting the project verifications, and then ultimately sell the credits in the international carbon market to gain the carbon finance for the investors. So this is the specific technical expertise we do have.
With the Jospon Group taking the lead in exploring the positive aspects of climate change, it is expected other sectors of the Ghanaian economy will follow suit to increase the country's carbon rating.
And you're watching The Pulse on the Joy News channel. We'll return shortly.